then we will ask patient, lay on the supine, please. You are the examiner. First, you will stand in the end of the bed. You will ask the patient, ideally we have to put the, the gun up to the nipple side and down to the pivot. So you opening so you can see. And I will ask Mr. Jordan, can you make a cup? Lay down. Okay, you go pay attention to the umbilical see have a hernia, okay? And cough again, then you want to see have any important hernia. Okay, now he's safe, right? Then, examiner go move on to right side. I'm going to give you a pillow right now, okay? So for the abdominal assessment, you do 4 things: inspection, auscultation, palpation, percussion. But abdomen and the neck, there's a mandate you do the auscultation before you touch patient. Okay? So for example, I just did the inspection. I'm just doing skill. I'm not going to do the test out, right? So I don't need to confirm the patient. I'm just going to show you the skill. Okay? So don't say maybe not to identify patient. Okay? Don't say I didn't wash my hand. Okay? I always have a hand washing. So I come in patient the left side, and then I will continue to do my inspection. What should I try to see?
Is any pulsations, any discoloration?
Color change, shape, okay, scar, okay, those are very important, okay. And then now I told you, abdomen you have the auscultation. You will, from your textbook, they will suggest you from right lower quadrant. But usually I ask patient have any pain. Then I start in the non-pain area. Do you have any discomfort right now? Okay. Since he is healthy, no problem, I will start in the right lower quadrant. Okay, you divided the 4 quadrant. If you want to do 9 section, okay, you just tell your instructor. Otherwise, I just expecting you do the 4 quadrant. Okay, based on your umbilical. All right, so I will listen. Usually 20 seconds. Hopefully you can hear a little fine bounce sound. Sorry. Okay, then you move up. Usually I will go, I start low, up, low. Okay, I will listen. After I done my auscultation, your stethoscope can put aside. Okay, so you will know is it active, hyperactive, hypoactive. Yes, Ms. Lee.
Are you going to have the patient ward before the assessment?
We will be, the instructor will be.
I mean, the patient has to go to the bathroom first.
Usually you will ask patient go to the empty the bladder,
Okay.
because you go to palpation. Very good.
Is there also, sometimes you have them put their knees up so that they relax their abdomen a little bit?
That will help too. Okay. Right now, I'm finished my auscultation. I will do my palpation. My palpation for you have a live palpation only. Okay, so one hand. Okay, one hand. So I don't know in the class did they teach you hand motion circle or they tell you how to do it?
She said to feel but not lift your hand all the way off of their skin so that if something moves, you would be able to feel it.
Yeah. That's why I don't leave my hand out to the patient. I don't do this, move up, I don't do this. I will keep on, okay? And I was standing here, look at my patient. I don't look at their tummy. I look at patient. If you feel any discomfort, let me know. Any discomfort, any pain? I keep and do that. Motion, okay? Then see, if you have a large size patient, sometimes I do is my both hand. Because maybe one hand is not enough. When I finish up, I will do my percussion. Same thing. From the lower, up, lower. Okay? And do 4 quadrants. Okay? That's it.
What if they got a gallbladder problem?
Gallbladder problem, we do the Murphy sign. Murphy sign, which we will use both hands. One hand support patient, one hand to try to feel the liver and, for example, you kind of know your rib. You're not supposed to feel the liver anyway, okay? You're not supposed to feel it. But you know the gallbladder is below the liver. So I will put on my hand, thank you, he put the hand up, okay, let it go. So I know here, so my hand wide open, and I will push down and move up. Put down, move up. See, he have any discomfort.
What's the process? What's he gonna do?
He will be very discomfort, and also you may able to feel the liver. And if you feel liver, you don't like it. Because if you're able to do liver, so sometimes we do the percussion, we try to hear. Because usually the bowel sound will be, sounds like what?
Air.
Running. Bowel sound. Tympanic. Okay? Be careful, we're going to ask you. Okay? If too much air will sound like correct. If they have a stool, what sounds like?
No.
Yes. Okay, so you were able to tell. Okay, what I'm trying to say.
So we're gonna do the Murphy sound and all the different.
Usually Murphy sign, I don't expect you to do it.
Okay.
If you're able to do inspection, auscultation, palpation, percussion, I'm pretty happy.
Oh,
So for appendicitis, they don't need to do anything special, just to do a regular assessment?
Appendicitis, we show them, but I think we will not test on them.
Okay.
So you don't worry about that.
What about ascites and liver span and all that kind of stuff?
We want, ascites, your percussion and your auscultation will be different. Because your percussion, you can try to know what fluid, but we won't test you.
Okay.
Okay, we won't test you.
It's on tape, you heard it? Yes.
We won't test you.
So it's not going to be a scenario then?
No.
No scenario.
No scenario. Let's take a